Hello, my name is Dr. Ralph Templeton. It is my pleasure today to introduce you to myself, my clinics, and my approach to healthcare in solving your problems. First of all, I've been a practitioner of chiropractic for over 26 years. My bachelor's degree is in nutrition science, and I have a postdoctorate degree in functional neurology. So when I approach your problems, I do it from quite a broad-based platform, one that allows me to focus on the cause of your problems. And since our facilities are integrated with medicine, we're able to help you come off medications if you feel like you're on too many or you're concerned about the risks. We've learned over the years, speaking of my facility, that medicines can cause back pain. A lot of different things can cause back pain. And since most people go to a chiropractor for back pain, they're unaware that they may be having issues that's caused by the treatment of other modalities or practitioners. So we're able to discern that and help you with that. We have nutritional therapy for any disease you can think of that helps you reverse or back your way out of perhaps a morbid disease that is causing you much of your problems. So when we invite you to share with us your health history, it is very important that you share it all with us, because myself as well as the medical practitioners may be called to look in on all the medications that you're taking, for an example, as well as your pathogenic causes for maybe a family predisposition to a problem. So we take the whole thing in and we focus on you and your problems that way. We're aimed at getting to the cause of your problem, and we have many different practitioners available within our business to help us arrive at a therapy or a number of therapies that will help you become healthy again. There's a lot of misunderstanding about what chiropractors do, and what I do in particular as a functional neurological practitioner. So what you're about to see is an interview with a patient where I'm discovering and uncovering clues as to why she is experiencing these problems and how many are linked together and that sort of thing. So I want you to pay careful attention to what the patient is telling us is wrong, how long she's had this problem, and so forth. This is very critical that we pay attention to every little detail and every clue that she can express.
Here today to see Dr. Templeton. I came in with shoulder pain, arm pain, lots of numbness in my arm. I have had stomach problems. I've had IBS for years.
Irritable bowel syndrome.
Yes.
And you're currently taking medications for that or
No.
something like that? You're taking something for reflux?
Reflux, right.
All right, like a proton pump, you said, I think it was Privoseg or Prilosec?
Prilosec.
Prilosec, okay.
Prescription Prilosec, not over the counter.
Okay.
And it helps. I've been taking Neurotin to help the nerves in my neck, my shoulders. I've been taking that for about 11 to 12 years, and I'd really like to get off of that.
You had surgery, you had shoulder surgery in the past.
Right.
And for rotator cuff tear.
Yes.
And that was, you're a hairdresser.
Right.
And so that was practically a career-ending injury for you, correct?
Right, it was.
All right, and so you're able to maybe only do one head of hair
At a time.
at a time, a day or something, or what?
A day.
A day, one a day.
And then in between that haircut, I'm having to shake my arm out and try to get my feeling back in my
Okay.
hand.
Is it more one-sided or the other?
It's one-sided on the right
On the
side.
right side. You have any chronic pain when you stand for prolonged periods of time?
Yes, my lower back.
Your lower back starts to hurt after you've stood a while.
Yes.
Are you waking up in the morning with it not hurting?
No.
So it hurts in the morning too?
No, it doesn't hurt in the morning.
Okay, so when you wake up it feels fine,
Right.
but as the day wears on your low back bothers you?
Right.
Okay. You wake up in the morning, does your neck hurt?
Yes.
Okay, so that hurts when you wake up.
Yes.
All right. Do you have any problems with balance or equilibrium from time to time?
Yes, I do.
All right, how often? Once a week, once a day, once a month? Is there any rhyme or reason to it?
Mm. Seems like it's more when I'm closing my eyes.
So when you close your eyes, you seem to become unstable a
Right.
little bit. Okay.
Mm-hmm.
All right. The room doesn't spin though, but you
No.
just sort of feel unsteady.
Right.
Okay.
Yeah.
All right. In order to understand this fully, you need to appreciate the fact that we're actually dealing with the central nervous system and the parts of the brain that calculate posture and balance, and in fact maintain the maintenance and so forth of our posture and balance, which is the cerebellum. The picture noted here, the purple area underneath the cortex, that is the cerebellum, and that really means small brain. But every sensation in the body, from all your weight-bearing joints, will cross through this tissue. And so it connects with functions from the eyes and the inner ear. So weight-bearing joints, inner ear functions, eye movements, neck sensations, in other words, when I talk about weight-bearing joints. So watch this. Take a deep breath in. All right, good. Now let it all out, nice and easy. Close your eyes. All right, you can see she's got a little side to side there, and so now she's drifting a little bit. Okay, open your eyes. Okay. All right, take a deep breath in. All right, now let it out. Okay, good. All right, so now next we're going to move over and lay on your back here. What we're looking at here is a side view of the cervical spine. Of course, you can see the skull up there. But if you look carefully at the joint spaces between the vertebrae, the upper several joints are what we would call normal, healthy joint spaces. As you get down to the center of the picture, you'll see where the joint space has elongated in width and narrowed in height. And this is degenerative disc disease. Now you can see here, if you injure C5, it goes to the thyroid and into the arms. Furthermore, depending on your viewpoint here, you can also see where the nerves go into that right shoulder. We're going to ask you to, without moving your head, we're going to ask you to move your eyes one side and then the other. Without turning your head, I want you to look to the left, hard as you can, straight left. Alright, you see that comes even. Alright, now open your eyes, look straight to the right. Alright, that makes them go quite short. Alright, look straight ahead. Alright, they're still short. Look again to the left, straight away to the left. Alright, now they're even. Okay, so what's going on when you move your eyes to the left, that causes the right cerebellum, which controls lateral eye movements, that causes that to become more facilitatory in its control, and it actually changes the computation of inner ear and eye movements that your brain is using to control posture, which is what your leg links are. Okay, so left-sided problem somewhere, right-sided problem. It happens to be no coincidence that you're having the brachial plexus problem on the right, because if you're injured on the right, you're going to fire a lot of pain signal into the right cerebellum. Problems with the functions in the muscle, smooth muscle. Alright, so what we're going to do is, we know the problem is right-sided because the eye movements have directed us to understand that. And so what we're going to typically find is, as we work your head in reverse, we're going to find some part of this neck that isn't going to want to work that way, and it's probably going to be on the upper right where it's going to be sore. But we have to just sort of find it where it is. Alright, right in there.
Yeah, that's it.
That's it, isn't it?
Wow, yeah.
Alright, so what we're going to do is we're going to adjust that. Alright. Now we're going to kind of just work this down here where you've been injured. Alright, there you go. All right, you felt that kind of go in extension, right?
Yes.
So far, so good? You okay?
Yeah,
No problem, right?
no problem.
She's with her eyes open, looking straight up. She is perfectly even. You might want to get over that a little more. There you go. All right, you can see she's perfectly even. All right, look to the right. That used to make her short. All right, that does not make her short. Okay. Now, let's see how your balance is. So, let's see how steady you are on your feet now. You already look better.
I
Okay.
can tell the difference.
Okay. Just get still as you can. All right. Okay, now close your eyes. Let's see how that works. Well, that's perfect. Right? Yeah, that's perfect. And you can see that her leg lengths are balanced here already. You can just look at that real close and see that they're even. All right. So we're going to bring them up and see if there's any built-in twist there, and it looks pretty good that way too. So that looks like it got it all. Even though you were having chronic low back pain, it was because your weight was shifting throughout the day. You are restricted over in here. You feel how it is down in there? A little tight, is it, Sheila?
Yes, it is.
Okay. Not so much over here, huh?
Right.
Okay, it's all right in there.
Yes.
Okay, so basically this hip here has kind of come up and over, all right like that. So we're just going to kind of lay her on her side, and it'll untwist. We'll just give it time to do that. You want to lay on your side facing me, please? Okay, Miss Sheila, it's been 5 months or 4 months? Yeah, 5 months. Tell us how you're doing. You came in here for neck, shoulder, and arm pain. How's that?
I'm doing much better. Much better. My neck is, I would say the rotation of my neck is 50% better. And my lower back is much stronger. Pain is not there.
You're having reflux?
And the reflux is much better. I went off of my medication. Have not had any medication in about 8 days, and I'm doing good.
And the dizziness?
The dizziness has gone away.
Okay. And you've had how many visits?
5.
I mean, shame on you, by the way, but yes. Thank you.
Busy life.
Uh-huh. You got anything to say to the crowd?
Thank you, Dr. Templeton.
So, what we've seen here today is a lady who came to us suffering from debilitating shoulder and neck pain. And as it turned out, she had other problems that were caused by it, but she didn't know it. She had acid reflux, she had irritable bowel syndrome, she had dizziness, and all these, as we demonstrated, were coming from the degenerative disc disease from her neck. Once we corrected that, all the problems went away, and on only 5 visits. That's pretty impressive, you got to admit. I'm Dr. Ralph Templeton. I look forward to seeing you or someone you love in our office very soon.